Hello there. Welcome back here on Prime Morning. It's a good morning if you just joined us here on the show. We appreciate your constant, time that you spend with us here on the show. We are up in the last lap here on Prime Morning, and we're getting into Prime Insight this morning here on the show. Before we get into that, let me remind you that this weekend on Sunday at 8:30 p.m., you're going to be watching another episode of the new reality show in town, the best you can ever catch on television. I'm talking about Cues and Lyrics. And well, if you watched the last Sunday, you would appreciate that the contestants are ready to give you a very big show the coming weekend. So you want to make sure you're also watching and hoping that your favorite eventually becomes a winner. You need to vote, by the way. That's the only way the person is assured of getting to be the winner, all right? So please go ahead, enjoy the very best of it. Our judges, our presenters are ready to wow you on Sunday, 8:30 p.m. as we make another beautiful, beautiful time with the contestants of Cues and Lyrics. Cues and Lyrics, they say what? Bring on the music. And we're excited about it. All right, so folks, we're getting into the conversation right now, but I want you to also be part of it. So you can go on our social media page on Joy Prime TV, on Facebook, Instagram, and on Twitter, and send your messages over there. Your contributions will be well appreciated here on the show. Our WhatsApp line is active. You can also send your messages there and let us know what you think about the conversation we're just about to have. Now, for those of you on social media, I'm sure you have an idea what exactly we're looking at today here on the show. But for the purposes of our conversation this morning, let me just get you into it a bit, and then I introduce my guest in the studio here for us to take a look at this very serious, I put it that way, a very serious conversation. Now, historically, oral sex is part of human sexual behavior, even though some consider it a taboo and its expression is actually deemed inappropriate. Now, human rights also stand out as technology becomes more sophisticated, leading to its practice disclosure in the 21st century. A large-scale oral sex discussion in media encourages people to actually express it, and there is feedback on whether it is right or not. It all depends on each person's values. Now, we've found this sexual behavior occurs everywhere, regardless of religion, culture, and race in a research that was put together. Now, pop culture influences this behavior considerably. It can also be seen in music, movies, and television programs that allude to oral sex. Numerous motivations underlying this behavior include sexual pleasure for the sake of psychological well-being. It is also undeniable that this behavior is still controversial, and yet indeed there is a risk of it causing disease, but it reportedly provides many benefits, which of course a lot of people have held on to it and even disregard the health implication that comes with it. This morning, we're taking a look at oral sex and throat cancer. New research suggests there's a linkage, and to help us understand this better and also put into better perspective, I have in the studio with me Dr. Kenneth Baidu. Dr. Kenneth Baidu is my guest. He's an otolaryngologist and the head and neck surgeon, head of the ENT and New Allied Surgery at Kolebu Teaching Hospital. So he's got a very big portfolio, and he's going to help us understand better what the oral sex and also throat cancer have in common, or if there's a linkage to that. Let me welcome our guest in the studio. Doc, good morning. Good to see you.
Good morning. Nice to see you too.
Great. We're grateful that you're able to join us this morning. We appreciate your time.
Thank you.
Good. So to start it off, I want us to get the explanation of the link between oral sex and throat cancer. Is there a link? Can you explain that for us, please?
Well, thank you very much for the opportunity. Throat cancer has been with us like forever.
Okay.
Yes. And historically, throat cancer was caused by alcohol, tobacco in all its forms, those who chew, those who sniff, those who smoke. And over the years, people have, it's been there, we manage it all right. But then in the basically like around 2000, just before 2000, and there was this, it was noticed that quite an unusual crop of patients were coming in. Patients who didn't have the typical like
situations
risk
of okay.
So, but a little if you actually go back a bit, just around that time, one Prof. Harold Hausen has made the link between a sexually transmitted infection and cancer of the neck of the womb.
Okay.
For which he won a Nobel Prize in 2008. And so now back to our throat cancer.
Yeah.
This crop of candidates, they didn't have the usual risk factors.
Yeah,
so
like you mentioned earlier.
Obviously, we had to look for a reason. And then it was found out that this same virus that they found in the neck of the womb causes the same thing in the throat.
So when you say neck of the womb, what does that mean?
Well, that's and the womb is the uterus. So the cervix of the uterus. So it's more like a female disease.
Okay.
So the same virus can be implicated in the throat.
Okay.
And basically, they found the telltale signs there. So obviously, you don't have to do brain science
to know,
put what they want, one and one together to give you two. So that's where it started from. But I looked at the source of basically what brought about all this discussion, and the gentleman had looked at all these diseases over the years, and he'd basically it's raising from 40% to like 70-something% now. So then it tells you that
it's 74%,
Yeah, so it tells you that it's rising. Yes. You ask, what is our situation here? Some work done by one of my colleagues, though she looked at oral cancers, which is not too far from oropharyngeal cancers. She found a 3.4%. Yes, which if you compare to the 40 and 70% is not that much.
Yeah.
But then oral cancers, though they are HPV related, I won't say they are, but some can be HPV related. It's unlike the oropharyngeal one with the farther back in the throat. That is like most 80% to 95% of oropharyngeal cancers now are HPV.
Okay.
That is in the West, yes. In ours, we now basically, anybody who comes with oropharyngeal cancer, we look for HPV in the specimen. And like almost every other one is. But then that doesn't discount the other risk factors which we've known since time immemorial.
Wow, very interesting. So let's look at the factors that you mentioned now. So some of the factors that actually contribute to the increase of it. We want to see why it's getting on the rise. So we're basically looking at it from the oral sex point of view. Are there factors? If there are, what are some of the major ones that you can mention for us?
Well, related to oral sex, it's primarily it's a sexually transmitted disease in the first place.
Yeah.
And then if you start having sex quite early, so early teenage, all those.
Yeah.
If you do that early, then you are at risk.
Wow.
If you have multiple partners, so what do you call it? But they put it at if you have more than six partners, then you are at risk. And then so it's the frequency, the early onset of it. Yeah.
And then the number of partners.
Yeah.
I see. So then how common is this cancer?
It's not very common.
Okay.
Like I said, the oropharyngeal is not very common. For cause of death is around 3% of our people.
Which is still a problem though.
Well, yes.
Depending on how you look at it. Yeah.
Yes, throat cancer by and large is not a huge component of our cancer burden.
Okay.
But it's a significant component of our cancer burden. And the people who manage them are not that many. So it creates that difficulty in assessing adequate care, and coupled with the fact that most of our people, as obvious as it may seem, still come very late and creates even more problems because now it's much more expensive to manage such patients.
Look, let's look at, okay, for example, now if somebody's going through that process now, what are some of the signs, the warning signs, the symptoms the person would see, and then we'll be able to assess that, okay, before I even go to the hospital, I think these are things that I'm experiencing that I need to, move to the hospital to get checked out.
Right, so one of the first things that will always occur is pain.
Pain.
You have
pain in
your throat. Another insidious one which can basically throw you off guard and put you in a different, line of search is when you have pain in the ear.
Wow.
So most people can present with pain in the ear and everybody will be looking into the ear and nobody will see anything and will be thinking, oh, but your ear is fine, when the problem is in the throat. So pain, either in the throat or in the ear. And the pain can get worse when you swallow. And if you get to the level where you can't swallow at all, then like you've waited like too long. And once in a while, you can see a swelling or a sore in your throat. But then there are quite a few who just present with a swelling in the neck.
Okay.
So the person is walking around and it has a swelling in the neck. And for all intents and purposes, you look in the throat, you look everywhere, and you can't see anything suggestive of.
So, but, not to catch you, but what's the link with this? So my throat is supposed to be the problem.
Yes.
I'm getting pain in the ear.
Yes.
My neck is paining me and all of that. How does that happen? That's on my ear, man.
No, that's why otolaryngologist. So we are basically ENT, so ear, nose, and throat.
Okay.
Not for nothing. That combination, because something can appear somewhere in your ear. You feel like pain in the ear, and the problem is in your throat. You can feel some pain in your throat when the problem is your ear. So that's why basically we look at all these things together. Having said that, it's just like when you have a sore on your leg, you get this swelling in your groin, which is just the lymph node. So similarly, whatever is going on,
I experience that a lot.
Yeah, will produce this swelling in the neck, but especially the HPV type, it will just produce this swelling, and the person is walking around with a swelling in the neck. And it's no wiser. We sometimes call it, we look for it and we can't find it. We say unknown primary, but we know this is a cancer, but then we can't find the source of the cancer. And most of the time it's in the tonsil or it's at the back of the tongue. And all these things add to the fact that you have to be proactive in trying to get to the bottom of some of these things we find on ourselves.
Okay, so if you just join us here on the show, my doc is here with me, and Dr. Kenneth Bedu is helping us understand our topic for this morning. We're looking at oral sex and throat cancer, new research suggestion in linkage, and we're trying to understand better what it means. Now, you can be part of this conversation by sending us your messages on WhatsApp or WhatsApp line on your screens. You can drop your messages over there. If you have any contribution, anything you want to understand, you can send your message there, and Dr. would respond to what. You can also do so on social media. We're streaming live the program, so you can also check there's Prime Insight, and that's our conversation for this morning. So, Doc has been able to explain to us, the link, the percentage, and all of that. One thing that I want us to take a look at, Doc, is the steps that people can actually take in making sure that they are able to look at, how this can be a problem to them, and then they can manage it. So how do we go about it? Because this is something people find a lot of pleasure in. And when you even speak to them about it, they feel like it's even a myth based on where you're coming from and where they are coming from. So what can we do to make sure that we are not able to, push on the risk factors that much?
The problem here is most of the time when these things are going on, you don't get the problems from it.
Okay.
So just back to the smoking bit. People have smoked 30 years ago, stopped. Maybe he was in university with friends.
Yeah.
Maybe sometimes for company, just for peer pressure.
Yeah.
Smoked in university, 30, 40 years down the line, that is when they now come with the problem. So yes, whatever is happening now might not be now. It's just when you are a little older. Unfortunately, the cohort of, I told you, they notice these people without the usual risk factors.
Yeah.
They are younger. So now people 30, 40 are coming with throat cancers. When earlier on it was 50, almost hitting to 70. So this cohort are coming earlier in. Tells you
And
how
that's very unusual.
that's the unusual bit.
Yeah.
Somebody who female, it's like the usual females are not that adventurous to have all those risk factors.
Yeah.
They don't smoke, they don't take too much alcohol. Yes, but then they come in with throat cancer and you ask yourself, where did this lady get it from? You understand? Then, and they are much younger, not that they are older. And when you get older, all these things can raise their head so that sometimes you can understand. But when they are younger and they like, then it becomes a problem.
Look, let's look at the risk factors that you mentioned again, male and females. Who's more at risk?
From data, at least from what I see at my clinic, it tilts towards the males, but then, a female, in quotes, appears odd because they don't seem to have the risk factors.
Okay.
They are not, if they don't seem to have the risk factor in the sense that you don't associate, that could be a little prejudicial, but then you still associate with them.
Yeah.
So then it becomes, we get worried. And quite a little disheartening in the females, you get a little bit more like, a little bit more aggressive. That indicates, makes it a little disheartening when one, you didn't expect it to be there, it comes and then it's not the kind type, that kind of thing. And so looking at my numbers, yes, on paper, a little bit more male predominance, but then a similar cohort.
So it means the men are more adventurous than the women in trying new things.
Most probably.
Because that's what is going to take you to where you are right now at the moment.
More or less, yeah.
Okay. So there has been also other conversations that have come up with regards to oral access, and it means that some females are more interested because the guys want that to be done to them more than the females would want to request that the man will do that. Did they not have any effect on it in terms of the more at risk female?
That I don't know. Yes, because I don't.
Maybe I'm coming from a very youthful.
That I don't know. Yes, but then there are people who, with that expertise, can explain much better. Yes, basically I'm the receiving end of all those. All those things.
Yeah.
So but the HPV is a serious business.
Okay.
The HPV, and as much as I want to stay with the topic, the HPV, we've got the major ones which cause the cancers.
Okay. Doc, I'll let you move on, but maybe you can explain a bit about the HPV, what it means and all of that, so that our viewers, can get
right. So HPV, in essence, is human papilloma virus.
Okay.
There are about 120 types.
120
types, yes. And they basically love the covering of the human body. So your skin, the lining of your mouth.
Okay.
Anywhere there's a lining, they thrive.
Okay.
And there's about 40 of them which thrive in the lining of the human body. So they are anywhere you can find covering. So your intestines, your mouth, even on your skin. You find people, they can find some growth on your lip. And those warts, we call them the warts. Yes. And they are found in the anogenitalia area, so the anus, all the genitalia. And so there are some low-risk ones and high-risk ones.
Okay.
The high-risk ones are those that cause all those cancers we are talking about. And they're also the low-risk ones. That's when you find them on your skin. But passionate I am about is the low-risk ones who cause problems in the throat of very young children.
Okay.
Say from the youngest I've seen was a 6-month-old child.
6 months?
Yes. And we call it papillomata. They grow around the voice box. And they cause them, they will have a poor voice, so they lose their voice. And then if you don't do anything about it, once it's growing, it blocks the airway. And then they have problems breathing. And then the only thing that, because it's a slow growing thing, people don't pay much attention to it.
Yeah.
Yes. And unfortunately, this virus is basically immortal. The word they use, it immortalizes itself in your tissue. So it's like it's there and it keeps growing and doing what it likes. But the low risk one, all that just keeps growing. So we go, and my boss likes to say, we go to like weed the grass, because they grow, you go take it off, they are breathing much better, but then over time it regrows again, and it's like never ending. The last very serious one I had was like they were coming to hospital like almost every 6 weeks.
Wow.
You see, and it's not covered by insurance, so young parent with a child with this condition, you can just imagine.
It's expensive.
Well, you need surgery. So at any time you need surgery and general anesthesia, it's not going to be cheap. Yeah, so that is the less or the low risk.
Yeah. So
guy.
you can imagine that.
So the high risk guy is what basically has brought us to this conversation. Yeah. So it's something that has to be looked at. Yes. Unfortunately, we are saying even this children, the children who suffer from this, in essence, are victims, because most of the time the mother, well, that's what we think, during the birthing process, as the child goes through the birth canal, that's when they contract the disease. And this mother must have been infected by, obviously, the father or whatever.
Yeah.
So they are victims, and then they suffer all these things. Push further, there's a possible malignant transformation. So although it's a low risk one, over time it can become a cancer, but then that is down the line. So that is HPV for you.
That's serious. Now, so the most important thing now will be how we've been able to research into some of these things and how the challenges have been. Have there been, researches into it? If they have, what are some of the challenges that, researchers face in trying to study this topic?
Well, once we are talking about it, means people have looked at it. Yes. And last year, we usually celebrate World Head and Neck Cancer Day in July. One of my colleagues sent out, made this a poll, and we sent it far and wide, basically to the young people, just to test their pulse, and nobody responded. And it was like an anonymous thing. You put it on the platform.
Was that expected from your angle, or did you expect that it will go that way?
Should I say? Well, anything is expected. So though we were surprised, at least nobody respond to my guy and say, "Oh, gentlemen, I've got it. I won't answer." But nobody said a reply. So the young man was disappointed, but then what can you do?
That would be very disappointing.
And it's anonymous. So it's unlike, basically, if I come and sit in front of you.
Ask me a direct question.
Sort of, yes. So now back to our discussion. In essence, so even now, once you come with throat cancer, we have to go through all these questions, asking about your sex life, your number of partners. And you see people crying and the like, but what can you do? We just have to get to it. Yes.
Okay, so we're going to try and see some of your questions that you have sent, and then I'm sure Doc would try as much as possible to answer some of them as well. So this one over here says that, good morning, host. Please, the Dr. Kenneth, I'm watching him live from GCPS. and also holding the lights of the college. Good work done, and the submissions are on point as well. Absolutely, they are. And this one is coming from James Amadume, Academic Affairs, GCPS. Doc, I'm sure you have an idea. Okay, yeah. So Doc is spending some really good time with us here this morning. This one says, "Good day, sir. My regards to Dr. Ken Beidou. I'm watching him live from Gethsemane Methodist Church. I'm Emmanuel Otre." Okay, Emmanuel also sent in that one for Doc. Let me see. This one says, "Good morning, Dr. Kenneth Beidou. Does it mean cancer is changing form, or is it communicable? What are the way out of this? Thank you for the enlightenment." Elijah from Nigeria, and it says, "Can you also spell out what comprises of oral sex?" Doc, which one do you want to answer?
The last one, obviously not.
Well, and Doc is not saying no on purpose. I mean, there are other people who are, in these areas that can explain better. And so Doc is trying to stick to his area. So, yeah, I'm sure that's the reason why, but it's not on purpose. All right, so Doc, yeah.
Right. So the question as to whether cancer is changing, it's...
communicable, yeah.
Yes. I think we have to more or less agree to the fact that it's getting communicable, you see. Because if I can get an infection, and then the infection can lead to a cancer, then it's more like you can contract it from that infection. Now, and because of that, actually, there are vaccines which have been developed.
Okay.
And we have it on the market, basically to protect the females, because if female cervical cancer is viral, then you have you have a vaccine against it. Then and there's evidence to prove that it has reduced the incidence and the severity of in the female.
Okay.
Yes. And the other thing is what I talked about, the low risk one to work done in Australia seems to suggest that once the females are getting vaccinated, it's bringing down the incidence of this low risk one in their children. You see?
Yeah.
So in our department in Kolebu Teaching Hospital, all children who come with that condition, we get them vaccinated.
Okay.
Irrespective of whether male or female. Yes, we are yet to process the data to see whether it follows the trend like as seen in Australia. But then the difference in the Australian one is that it's like across board.
Okay.
So, but we at least the last information I have, I think ours is still voluntary, so that it's to girls. It's given to girls, I think, from 12 or from 13. I'm not too sure about that. So that's it. But then there are advocates, especially in the UK, they were advocating for male and female. Australia, I think that's it, male and everybody. But because it's sexually transmitted, so it's better to give both male and female.
Yeah.
Yes, but then at most risk is the female, obviously.
Okay.
Yes, but then if we can, I think we can do it for everybody.
Awesome.
Yeah.
Awesome.
And that at least that we can reduce that by itself, even if it reduces it by 30% or even 20%.
Yeah, that's a bit drastic.
It's significant. Yes.
Okay, well, just about wrapping up. But Doc, before we go, you've spoken about awareness. We've spoken about all the other things that we need to know about it. If you're giving advice, to young men and women, very exuberant people who won't be adventurous and all of that, what would you tell them? Because they need to know that yes, they can have fun, they can do whatever they want to do, but then there's also a cancer of the throat, from oral sex that is waiting for them from a doctor's perspective.
No, that's a difficult thing to say. Why? Because most of these things, the effect is down the line.
It will take a while.
Yes, and we are getting this information now because we know. There are a lot of things we are doing or we may do which has consequences we don't know of yet. So basically, for me, in life, you just have to be cautious.
Yeah.
It's good to experiment, but go in knowing that you are putting your head in the noose, which we may not be able to take
You're at high risk, actually.
Yes. So you just have to be cautious, and I'm sure we'll do well.
Okay. All right. So that's Doctor this morning for us. Doctor, thank you so much for making time for us this morning and enlightening us on all of these that we're supposed to know. We're grateful that you're able to make time for us.
Thank you very much.
Great. And that's Dr. Kenneth Baidu, and otolaryngologist. That name is very powerful. Head and neck surgeon, let me put it that way, head of ENT and a new allied surgery, Kolebu Teaching Hospital. So he actually also at the point in time explained that. So basically it's the ENT, and that's where he's coming from, Kolebu Teaching Hospital. Doctor has been very, 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 great with this discussion this morning. And so we appreciate him for that.